Hey guys, it's Dr. Emer. We are in session, is this one 6 or 7? 7. Our patient that has a rare congenital birthmark. You can see it here, nevus avuta. And if you zoom in there, you can see all this pigmentation through here. These are deep birthmark cells that are very hard to remove. She has numbing right now and an eye shield. And what we're doing is we're using a amazing laser from Canada, made in Germany, distributed in Canada, called the YAG laser. But actually it's multiple wavelengths, so that was our first pass. We're going to switch now to the Ruby. We're also going to use this Describe patch. You can see it's called the PFD patch, which stands for perfluorodecalan. You can see that here. I'm going to wipe this material, PFD, all around. And what this is going to do is going to allow me to do more passes of the tattoo laser without the gases that are being released to block. And so if you take a look, I'm going to switch the thing. You can see how we've done in the multiple sessions. Take a look at the difference. We're greedy. We're going to do two total more to get as much as we can and do a peel. And perfect. And you can see, look at that result. So show them up close that result. Now with the Ruby, I'm going to switch over now to the Ruby. We just did the YAG. The Ruby laser is one of the hardest lasers to find on the market right now. It's expensive to make, expensive to have, and hold on one second. A lot of people don't know how to use it. What was the? Do you know the strength?
Yeah.
From the Ruby? That's what I thought. That's what I want. A lot of people don't know how to use it, but let me tell you something. When I was a resident, we had an old school Ruby, which basically takes up an entire room. It's huge. And what I did, I just told all my friends, let's laser you. And I didn't even know what I was doing. And I just started lasering them, and then I learned how to do it because I tested it out on people. Oops, I dropped my goggles. You get... Hmm?
Dr. Emer says, do you know Dr. Epley?
I do. Got it.
Someone's
I
asking.
do, yes. All right, here we go. So we're going to start now with the Ruby, and you guys can see, look at that difference. Now this birthmark can actually go into the eyeball, so that's why you got to really watch this over time. And so you guys see that white frosting? It's not actually a frost. It's coagulation and gases being released in the skin. The unfortunate thing for Ruby is that it's slow, 1 to 2 hertz, that's it. You guys gotta move a little bit because the shadowing is blocking me. Thank you. And you guys see it's going right through the patch. This time, instead of doing just a specific area, we're doing a wide area. Hold on, Mike, can you wipe this? I guess it's hot in here. It keeps getting me. Give me more of the gel for the juice. More of the PFD. So she's got an eye shield in, which is why we can do this over her eye. Okay. And again, we're using the ASCLEPION device, best company for laser, by far when it comes to tattoo removal, especially in hair removal. As you guys can see, there we go.
What's her downtime from this laser?
Tell them how you normally, because you've done this a bunch, what do you feel is the downtime? How many days does it take the peeling and the swelling? Sorry, honey.
Probably like 3 to 4 days.
And then what does it look like right after?
Oh, it looks way better, but it does look a little bit more pinkish.
Looks pink.
Yeah, and then maybe the day after that it goes back to normal. So pretty fast.
That's actually really good because in the old days, it wasn't like that. It took much more time. So you guys see, you just gotta be very meticulous, especially over her eye. But we've done so.
One of our viewers said thank you for taking care of their necklines.
Oh, you're welcome. I don't know who it is, but of course. Anytime. So you guys see, so now we're gonna move our way over. We're gonna move down here now. Over here, she doesn't have as much. Turn to the right a little bit more. There you go. Mainly concentrated over by the hairline. You guys can see.
What is post-care like for this laser?
So that's really important, especially for her, given her skin type. The ruby laser is the most dramatically affected to melanocytes, meaning that it can cause a white effect or a pigmented effect. So doing pigmented skincare, stem cells, Silogen Scar Gel, my Refit Face from emeragecosmetics.com, also anti-age serum stem cell to help the healing process. We use something called BioShield, which has growth factors in it to help it heal. And then Hyla B, which is a hyaluronic acid in my line, is really good for hydrating, senti-dermal repair, and then cleaning with a good enzymatic cleanser. What's really important in the old days is we used to do like petroleum jelly. Don't do that because it tends to push in heat and then people can get hyperpigmented, which we don't want. We're trying to remove the pigment. You can see. There's a fractional version of this laser, like a fractional Q switch, which is quite amazing, but not good for what she needs. She needs this full treatment.
Dr. Emer, do you do Botox to fight against ear movement?
Ears, yeah, you can. It just doesn't work that well, and you have to do a lot. So it does help sweating on the ears though a lot. If you're bothered by it, come see us. She's doing great.
A lot of people joined us recently. They're asking what we're doing. Guys, we are removing a birthmark right here around her eye. You can see this is her original before, and this is her after 5 sessions. Right now we are on session 7. Right now her birthmark is dramatically improved. She will have some...
Gone. Finishing the last pass. So if you guys notice, we're doing about 3 passes simultaneously with this PFD patch. If you don't have this patch, you can do more than one at a time. You gotta wait about 30 minutes between the sessions, and you can't go as strong because it will be too much of a reaction. So with the PFD patch, you can do much more. And she has eye shields, so that allows us to do this more readily.
Let me show you guys the before and after again. Here you
I'm
go.
kind of covering everything, even though she didn't have it all. It's all on her full brow. It extends up there, and what happens with these birthmarks, you guys, is the little baby cells underneath, they want to grow back. So if you do just the area where the mole is, it always will come back. If you do what I'm doing, the surrounding areas, like around here where the baby cells may be, then the chance is much less. That's why in this treatment, we're doing almost the whole area, rather than just the area of what's remaining, because that's 15 years experience. Telling you what to do, because when we first started doing this, we didn't know. Good. Okay, so you're asking, why are we doing everything? That's why. This is why the last treatment, the second to last treatment, take a little longer and have more of a treatment area. And plus we're doing the ruby, which again is more superficial, focused specifically on the melanocytes only. The first pass was our YAG. She's gonna look like hell tomorrow, okay? It won't even look that bad today. It's always gonna look terrible tomorrow. But she does these great videos and inspires a lot of people that have these types of birthmarks, which I love. It's all about helping people nowadays, right? We had all these negative YouTube comments yesterday, just delete them and just hide the people. Like, we're post-COVID, you gotta be nice to people. here we are, very meticulous, following each area.
You
This
know,
is Friday fun fact.
And if one of our viewers does have a birthmark or tattoo near move, please go to emercosmetics.com. You can book a consultation with us, or you can send us a DM with your full name, email, and phone number.
Perfect. Okay. Very good. So I'll show you guys as I take out the eye shield, because I know everyone always likes to see that. So again, take a look at the before and after. It was quite amazing. This was her initial before, all the way up close to the viscia. You could see the speckled depigmentation, dermal melanosis. But now here, look at the nice improvement. And we're gonna grab the shield.
Everyone's favorite part.
It's her favorite part too. Get that shield out, keep your eyes closed. Inside there's a little goopy ointment so that it protects her eye. And now she's good. We'll let her sit for a few minutes. We're gonna put stuff on here for her to heal, and then she'll be ready to go. So that's Neva Savoda, tattoo or laser for birthmarks, congenital birthmarks. Bye. Oh, you did it. All right, you're almost